Hello and welcome back to Season 5 of the MRX Lab podcast, the show from FlexMR, where this year we're on a mission to uncover the connections between data, decision making, and the best ways to navigate a fast-moving business landscape. Today's episode is set to be a fascinating discussion as we take a deep dive into the world of healthcare data management, interoperability, and what it takes to make this kind of highly regulated data ecosystem work. To do that, I'm joined by Keith Schoonover, Vice President of Client Strategy at KJT, and Laury Liu, Market Intelligence Manager at Intersystems. Welcome both of you to the show. Of course. Laury, for our listeners, could you tell us a bit about yourself and Intersystems?
Sure. So I'm Laury. My role at Intersystems is to really inform our decision making with in-depth market analysis, market insights, and primarily focusing on the healthcare sector. So through research and analysis, I help guide our strategic directions to make sure that our solutions, our softwares are aligned with the evolving needs of the healthcare organizations. So Intersystems is a technology company established in 1978. We provide data management platforms, integration engine, analytic solutions, and industry-specific applications to healthcare industry, financial services, supply chain, and public sector. So within healthcare, we are the true experts in data management and interoperability. Our technology manages over 1 billion health records over the world. Thanks for having me today.
Yeah, of course. Great to have you. And that sounds fascinating. That's a lot of healthcare records. That's a lot of data to manage. I'm sure we'll get into that soon. But just before we do, Keith, same question to you. Could you tell us a bit about yourself and KJT?
Sure. So my name is Keith Schoonover, and I have been in market research for a little bit over 20 years now. Work for a company called KJT Group. We focus specifically on healthcare research, on really all sides patient, on physician, clinician, as well as C-suite, and then companies like Intersystems that are looking to streamline information inside of the healthcare system. And I've been partnered with Laury for a couple of years now, conducting research in this space.
Great. So the first question I have, I guess, for both of you is really to help us set the scene. So could you tell us a bit about the healthcare data landscape and what makes that arena in particular so interesting and challenging as well?
Yeah, I can go first.
Sure.
I think the healthcare data is uniquely challenging for a variety of reasons. So healthcare data live in many different systems, such as EHR, the electronic health record systems, lab systems, imaging systems, and even like claim databases. And each of these systems speak different languages. Even within a single healthcare organizations, these systems don't talk to each other because each of the system are likely was likely developed by a different technology vendor. So they would have their own unique data formats, data structures, and sometimes even their own proprietary communication protocols. So the lack of interoperability is really a huge challenge or a huge barrier to sharing data and analyzing the data effectively. It could be really hard for physicians or to healthcare providers to capture a holistic view of patients' history, medical history. And another factor to that is healthcare data is not just text based. So it's a variety of data that from structured data like diagnosis or lab results to unstructured data like clinical notes, images, and even genomic sequencing data. So the complex variety of different data formats really add an extra layer of complexities there.
Yeah, yeah, great point, Lori. And I think, in my mind, there's really three main challenges when we're talking about healthcare data. One is just how much there is. There's just so much information. It comes from, it's not just on clinical visits, but, nowadays there's wearable tech. There's just so much information that, the health system is working with. The other one is just how different it is. There's such variety. And as Lori just mentioned, a lot of times these systems don't talk to each other. So that interoperability is really a big challenge. And then, the third is really that we're talking about very sensitive information that we just don't want to get out of that system. So a lot of protections, both government and then just industry standards that make it so that sometimes it's very difficult to move that information from one place to another.
Totally agree. And also, like, the sensitivity to the healthcare data is very unique. Like any errors in healthcare data could cause some serious, severe consequences. So there is really little room for errors.
Mm. And I suppose similar to that, as well as kind of that need for accuracy, there's also what you said earlier really struck me that someone has to interpret this data somewhere, and that's really critical as well. And if you, as a person, as a healthcare provider, are getting all of these different formats of information, not in one common language, that adds this huge interpretation challenge at the point of care and delivery, and when we're making decisions as well.
Absolutely.
Yeah. And, one additional point to that is that if you, as a patient, go on a vacation, and then hurt yourself or need to be in a hospital, that it's very difficult to get all that information about you from your home clinician. So that's another part of that sensitivity that's very challenging in that it's very difficult to get that your health records to travel with you when you leave your network.
So, just building on that point, what are some of the ways that healthcare data is currently exchanged? How do you get your data from one place to another?
Um, Currently, I think healthcare data exchange is still a mix of technologies from APIs to fax machines and CDs. So just recently, I had to share a CT scan with a specialist. And instead of being sent electronically, I had to take half day off from my work and pick up this a CD, an actual CD, and hand deliver it to my specialist. And while I was in the office of my specialist, I still had to sit on the chair for 40 minutes just so that they can download the specific software to read that CT scan. So I mean, there is still a lot of surprisingly dated technologies being used to exchange healthcare data nowadays. But thankfully, there are also some evolving methods. For example, a lot of the healthcare organizations now use something called integration engine, and actually Intersystems does offer that as well. So what integration engine does is to act as a central hub that connects to all the different systems, like system that we just spoke about, the EHR, the lab, so on and so forth. So the integration engine connects all the different systems and it translate and route the information as needed. And by the way, HIE, I think, is also a novel way to exchange data. It is, by the way, HIE is Health Information Exchange Organizations. So they act as a central hub to facilitate data sharing among health providers whenever the data is needed.
I think one of the main ways that information is exchanged, at least patient information, is through the electronic health record. We call it
Mm.
EHR. And one of the difficulties with that is that, if we're talking about an EHR system inside of one hospital, for instance, then all the pieces probably talk to each other. Now, there's other, technology they have that won't be able to talk to the EHR. But the problem is that each hospital is going to have their own type of system. So a lot of times those EHR systems, which is the primary way that we exchange patient information, they don't talk to each other right now, in many cases. So that incompatibility really makes it kind of clunky, as, legacy systems are still in place and aren't able to talk to each other.
Mm. And for context for our listeners, we're talking a lot here about the healthcare system in America, but we have the same challenges pretty much across the globe. Here in the UK, um, obviously the NHS is meant to have some degree of standardization across electronic health records, EHR. But between regions, there are still differences. There are still challenges with interoperability, with getting systems and patient records to talk to each other. And I wanted to talk a little bit about, I think what we've discussed as kind of an important development in modern healthcare, which is FHIR, Fast Healthcare Interoperability Resources Standard, I think, to give it its full name. Can you tell me a bit about what FHIR, what this is, and what makes it so important in this field?
So to me, it is I would call it a dictionary. It acts like a universal language, so
Mm-hmm.
that different health systems, different applications can talk to each other directly. And what's really unique about FHIR is it's really built on the web-based APIs. So it's the same technology that allows the mobile apps, the applications on your phone to talk to each other. So it makes data exchange fast and flexible. Nowadays, a lot of the healthcare organizations are actively adopting FHIR to exchange data. It really allows healthcare to become, in my opinion, faster, cheaper, and better. Yeah.
So what you're really doing here is kind of solving the challenge of compatibility between systems, but there's still, I imagine, some degree of challenge in adoption. That kind of this only works if everybody agrees that we're going to implement it. Have I got that right?
Yeah, that
Absolutely.
is right. And I think, one of the big things, one of the big changes that, we're trying to wrap our arms around in the market research space is to understand, what the awareness is, what the plans for action are, is that in the US, there's a new regulation that was passed. It's called CMS 0057. And what that does is it basically mandates that all health insurance companies, so the payers, that they all adopt this by 2027. So, there is mandatory full compliance that is expected from the health insurance companies to help speed the process, make sure that, patients have their authorization for any kind of procedure in a timely manner, be able to move all those records back and forth. But it is coming. It is really going to kind of change the healthcare landscape. That when CMS 0057 is enacted, FHIR will be used by the majority of the healthcare space.
So there's obviously kind of a legislative angle, but are there also other reasons that providers and payers are adopting FHIR?
Yeah. I think FHIR also empowers patients to own their health data. So one example is Apple Health. If you own an iPhone and if you take out the Apple Health app, you can actually access your own healthcare data. So what Apple Health does is it pulls all your medical history, um, medical data using FHIR. It allows you to really own your data and make decisions for your own health. And another aspect is that I think FHIR really empowers innovations. Like I said before, it's an API based standard. So it potentially allows the application developers to develop or build apps or tools with more advanced, you know, functionalities, from personalized treatment to predictive analytics. So I think those are also the additional reasons why organizations are adopting FHIR now.
I think that's really interesting. It strikes me as almost kind of this, sometimes in research, I guess we call it kind of like the democratization of data, but you've got one challenge in a way of getting legacy support and payers and healthcare providers using FHIR, but then there's also the future benefit where, because it's this extensible framework, there's a lot more freedom to use that data and give consumers, give the public different ways of accessing and making use of their own health records. And I guess that's just a really fascinating dynamic in terms of where we are today.
Yeah, I agree, and I do think one of the things we're going to see with FHIR once it's ubiquitous, once it's really common, is that patients are going to have a lot more access to all of their information. It's a safer environment for the general public to come in and access their information. Now, I know through technology, we all do have more access to our health information than we have in the past, but there's still limits there on what
Mm.
we're allowed to access. So FHIR is really going to it's going to empower patients to really be able to manage their healthcare with a lot more information than we have in the past.
So this is great, but I guess I also want to probe a little bit to ask if you see any challenges to adoption in the next couple of years before that 2027 deadline, both domestically in the US and internationally, if that is part of the vision for this as well.
The biggest challenge that I've observed through the research that we conducted together was really the resource constraints. FHIR has only been around for 7, 8 years now. It still takes a lot of skilled personnel, expertise, the experts in fires to really deploy that standard, deploy that technology within healthcare care organizations. And organizations are small or in the rural areas. They don't necessarily have the resources to hire these staff to deploy such technology. And the initial cost of adoption, of course, training and the ongoing maintenance of this new system can be a barrier. So I think before even if the long-term cost savings is associated with adopting FHIR, because FHIR could make healthcare cheaper, better, and faster, but it is the realistic challenge, the realistic issue that a lot of the healthcare organizations are dealing with today, that they simply just don't have the resource yet to implement FHIR.
I think another big challenge with FHIR is, as you mentioned, that this is a global platform that to really be efficient, it needs to be adopted across the globe. But really, one of the biggest challenges is that there are going to be different regulations in each different country. For instance, GDPR in EU has its own regulations, and then in the US we have HIPAA and a whole series of state level regulations. So FHIR has to be flexible enough to be able to protect the data to the standards of each individual country to make this work. And then once you do consolidate all of that healthcare information, which is highly sensitive, there's just that risk that some bad actor is going to figure out a way to get in there, and the data breaches are still a risk, as they are with any online platform. So once we consolidate all that information, it becomes even more of a risk.
Mm.
Yeah.
So although there's lots of optimism, there's still some challenges and some thought to be done around both the long term and, Laurie, as you alluded to, the kind of the more immediate barriers, especially to the smaller providers. And on that, we've got a little bit into some of the research you've done in this area.
Before we move on, can I
Sure.
add one thing? I actually heard this from a conference I attended last month, which was fascinating to me. I think another challenge for the to the limited adoption of FHIR is, so FHIR doesn't work in isolation. Like, in order for an organization to really take advantage of FHIR, uh, other systems that they work with or other systems that they exchange data with need to deploy FHIR as well. So that creates the chicken or egg problem. So a lot of the organizations, they're waiting for their partners, the organizations they work with, to adopt FHIR first in order for them to take advantage. So I would say that hesitation also creates, the barrier for a widespread adoption of FHIR.
So you've got kind of a bit of a standoff where everyone's looking at each other and waiting for the first person to pull the trigger. And then,
Exactly. Yeah, exactly. So hopefully with the government regulation that's, mandating a lot of the entities to adopt a FHIR, hopefully things will get better soon.
so the last thing I wanted to touch on today is a little bit more about the research you've done in this space, and specifically what you've learned from conducting research, and also what your advice would be to researchers facing a kind of a similar market, a very niche, complex research challenge. What would your advice be to them?
Um, One thing I've learned from, conducting these research within FHIR is that the adoption challenge is not necessarily around technology only. In healthcare, I think Keith mentioned that earlier. There's a mix of, the legacy system and, the established workflow. So a lot of organizations, they're hesitant to change. So it is really important to recognize that human factor and understand that the change, sometimes happens slowly. My advice to the researchers who are conducting research in, such niche market is really just set realistic expectations about the challenges you're going to face. For example, the recruitment is not going to be easy, and the participants or the respondents will have varying knowledge levels. So really focus on the real world applications. So, for example, for FHIR, instead of focusing on what this standard could do, I think Keith and I, we really spend a lot of time talking to the participants about, how it's actually being used within their organization, how they use FHIR to improve or impact patient care, data exchange, or even cost savings. So I think those real world applications really resonate with our respondents and give us a lot of the actionable insights.
That was a really good description, Laurie. I think um, one what our market research is really focused on is what is the overall awareness of FHIR, what is the adoption, what is the use that they're leveraging FHIR for, and then also like looking at CMS 0057, how much have they started planning for it, what are the what is the timeline for them to be fully compliant with 0057? Are they going to wait until the very last minute, or are they already working towards that now, knowing that it's coming? And then are they going to just do the minimum, very, what the CMS 0057 requires, or are they looking to really, wrap their arms around this and bring it into their workflow in as many ways as possible? So those are the types of objectives that we're trying to get out of a lot of the research that we're doing, just to understand the landscape that FHIR brings. But as Laury said, I think one of the biggest challenges is that there are a lot of people inside of an organization, inside of a hospital, who have no idea what FHIR is, and they really don't need to know. Finding those people who it's their job to understand this landscape and make sure that their facility is compliant, those people are somewhat hard to find. And I think what we found is that we had a lot of people who were the wrong people first before we understood how to find the right people.
I think that recruitment challenge is always difficult, especially when you've got kind of these complex organizations, and you've got to find the right person in that who might not have the same role every time. But then what I was going to say earlier is, Laurie, I loved your focus on kind of bringing it back to their frame of reference, not just talking about and researching what you need to find out, but understanding kind of their day-to-day life and bringing it back to what knowledge they can bring into that process.
Right.
I'm afraid we are running out of time, so I just want to ask one final question to each of you before we go, which is, what's the kind of one core message you'd like our listeners to take away from today's episode? And Keith, I'll come to you first.
Yeah, sure. I think the big takeaway I have is that FHIR is coming. There's no getting around it. It's going to be kind of the data exchange of the future. I know in the US, it's going to, in the next 2 years, it'll be fully implemented. But I think globally, we'll see in the next, 3 to 5 years that it is the way that hospitals work around the world.
Yeah, I couldn't agree more. Fire is coming, and as a patient myself, I think everybody is a patient or will be a patient someday. I think I'm really excited that I could take control of my own data, that I get to, save time. I don't have to take time off to hand deliver my health data to my other doctors or healthcare providers. So I'm really excited to the future of healthcare, how data could flow seamlessly, effortlessly.
I think that's a great closing message. The future of healthcare is coming, and data has a big role to play in that. How we interact with data, how we surface data, and how easy it is to get the right data into our lives. I appreciate you both being on the show today. Laurie, Keith, thank you so much again for joining me today. It's been a really interesting conversation. And thank you, of course, to everybody listening as well. We are out of time today, but we will be back next month with another episode exploring the frontiers of research and insight. Until then, I've been your host, Chris Martin, and this has been the MRX Lab.